Okay, so I am going to do very little talking and a whole lot of listening and learning, but I just wanted to briefly say why I'm here and why I am excited to help host this. To me, when you think about capitalism and the system, we don't think about the fact that capitalism is inherently ableist. And one of the things that we are supposedly guaranteed in this system is, life, liberty, and the pursuit of happiness. But if you don't have health, or a guarantee to health, then how do you have any of that, right? If you have to be careful because you're afraid of any little thing happening to you, how are you free? How is that liberty? How are you able to be happy? How are you able to pursue any of the things that are going to bring you joy in this world if your health isn't taken care of? And that's one of the reasons that I even push back against the use of the word worker when we talk about what we have to do to protect the people, because I don't want to capitulate to the idea that what any of us is able to provide in terms of work, in terms of what we can do, is what makes us valuable. We are all inherently valuable and all inherently worthy of protection. And the last thing I will say is, no matter who you are, the state of being able-bodied is inherently temporary, like life itself. Because whether we're talking about just age or accidents or anything, right? Anything can happen. And eventually, because of time, because of the way things work, your ability to continue going, especially as it is defined by capitalism, is going to wane. So whether or not you think that it is pressing for you now, it is pressing for you. And look, we can't get you to care about other people, but what we can ask you to do is understand that the better everyone around you is doing, the better you'll be doing as well. And that is, to me, why Medicare for all, single payer system, nationwide, worldwide would be great, but let's start with nationwide, is absolutely vital. So I want each of our panelists to tell us what they do and how where they come from in terms of being healthcare providers or working in the system, and the ways that you think you can tell us about why it's necessary that we have a single payer system. And whoever wants to start can hop right in.
Okay, I will certainly start. My name is Dr. Cheryl Kunis. I am a nephrologist as well as a bioethicist. And it's interesting, Logan, that you talk about if you don't have your health, what is there? One of the things that we really talk about in bioethics is that the government provides us with certain securities, such as a fire department, such as a police department, such as rules on the road that when it's a red light, we're supposed to stop, that we should wear a seatbelt to protect ourselves, and so forth. But one of the things that we really talk about is that healthcare is in itself a very sacred and different form of security that our government should provide us with. Although they should provide us with many things, healthcare is in its own right special and different. And under those circumstances, it is a human right and it should be available to all of us, especially in the wealthiest nation in the world. And I find it very interesting the way health insurance developed in this country and the way it developed in Europe, New Zealand, and Australia, and all of the very wealthy nations. It developed very differently and for different reasons. So, for example, when health insurance began in 1929 in the US, we were in the middle of a depression. And hospitals were suddenly developing and people were going into them, and nobody really knew how we were going to pay for it. Needless to say, it didn't cost what it costs now, but it was still something where the people working there had to be paid and the hospital needed resources. And a very interesting person in Texas had a great idea. He said, look, so many people are out of work. We are in the midst of a depression, but one group of people who always have a job at this time are teachers. So what we're going to do is we're going to ask all the teachers in, I don't know if it was Houston, Dallas, one of the cities in Texas, to donate a very small portion of their paycheck every week to a fund, and that fund will be used to pay for health care in the hospital. And most of them all did it. And that's why the hospitals became solvent at that time. They had a social consciousness that they realized this was important, number one. Number two, they were given a bonus to do it. They were told, should you ever need health care or hospitalization, it will be free for you if you make that 50-cent donation every week to our hospital fund. So this was the beginning of employer-sponsored health insurance. It was a great thing in 1929. It is not a great thing in 2022 because so many people work and their companies with the cost of healthcare just can't afford it. Now, the ACA was passed so that these people would be able to do it. But we all know, what is the ACA? It is a form of private health insurance, which is still very costly, very inefficient, and actually very unfair to the people who are paying for it. And I can give you so many stories about it. But what I can say is the expansion of Medicaid in the ACA has been shown to be effective. So I can applaud President Obama for that part of the ACA. Believe me, if President Obama had his way, we would have universal health care. President Obama, I truly believe, would have wanted it. But of course, he knew he was fighting a very difficult group of people to get anything passed. So right now, we are so worried about what's happening with the private health insurance industry. And most importantly, something which a lot of people don't know about, but that we in PNHP are really trying to make clear. And I'm giving a lot of lectures on it and speaking to church groups and senior citizen centers now. And that is that the government is now trying to privatize all of Medicare so that a private insurance company wants to take over the Medicare system, the traditional Medicare system, such that they are going to make huge profits out of our taxpayer money. I won't go into that now because I don't think we have time to, but this is my take on where we are right now. I also think that, and I was very taken by the Friday night lecture by the woman from Canada who talked about the healthcare system there and how they're doing it state by state. But it sounded to me that she really did think a federal system was the way to go. I think a federal system in many ways would be very easier, much easier, but I'm willing to fight for anything because one of the ways that I'm fighting with the PNHP chapter in New York for a New York State universal healthcare system is because this is education, this is advertising, this is letting the people in New York and the rest of the country know that we believe this is a system that's necessary, whether it's on the state or a federal level.
And so I will actually have to push back on a couple of those things. Obama does not care. He did not pass universal health care. He had every chance to do it. He promised it. He did nothing. Just like Biden could do it right now with 1881A, an executive order. Obama lost over 1,000 seats while he was president. He had the House. He had, Senate. He had the White House. He could have done it. I will make no excuses or rationalization for any politician who has caused violence to people who cannot afford health care, who literally are dying because of our violent system right now. And he absolutely could have done something about it and chose not to. As far as state by state, incrementalist, no way. That is completely means testing, inherently sexist, ableist, racist. It needs to be everybody in, nobody out, period. No caveats, no nothing. And that's what these entire 3 days are about. National. No, no settling for here and there. Well, maybe we'll do it first. Nope. National. We're asking for it all. Period.
Just two things. Just to back up Joy, we're seeing a whole lot of things going on state by state right now that we couldn't possibly trust most of the states, especially. I mean, we're not going to go too far into it, but state by state seems very dangerous, especially right now. And also, I just wanted you, Dr. Kunis, to tell everyone what a nephrologist is. I remember I had to ask you because I did not know. And also tell us what PNHP is, just so we have a little bit more of an idea of your background.
Okay. A nephrologist is an internal medicine physician who deals specifically with people with kidney disease, such as the patient who, actually James, who was just on the show before us, he is on dialysis. So when patients' kidneys don't function and they need dialysis or kidney transplant, nephrologists take care of them as the internal medicine physician. We take care of many, many patients with diabetes because they spill protein in their urine, and eventually many of them go on to kidney failure. So that's what a nephrologist is. I'm going to be telling you some stories during the period of time as to some of the things that we do and some of the ways I feel about the system. And PNHP is the Physicians for National Health Program, which is a national organization with many local branches. And we believe that healthcare is a human right, and we believe in a single payer healthcare system. Now, many PNHP chapters across the country only believe in a federal system. Others believe in a state system. Honestly, I am a federal person, but my chapter is working for a state program. And as I said, even if a state program isn't viable, I still believe that talking about it and educating people and bringing it out to the public, just like all of the results of the California situation where single payer died there. We just want to get it all out because, as you know, it is a movement and we need to educate people just like we're doing this weekend.
So we do have a panel on on the dangers of state by state tomorrow. I definitely want people to tune in. There are many, many, many problems with that, with even giving that air, essentially. And that's why we're having this 3 days forum. It is national. And the only way we're talking about state tomorrow is to show all of the flaws, be it 24 states don't even have ballot initiatives, be it CalCare was not single payer. And people like to say, oh, Medicare for all failed. It was not Medicare for all, things like that. So I think we have to be really clear that this panel is 100% to promote national.
I feel very strongly about that. And the experience that I'm familiar with is when they tried to get dialysis and transplant done on a state level, and they tried for 15 or 20 years. It just wasn't going to work. And in fact, when they had one state, which was the state of Washington, that was able to open its first dialysis unit in 1960 and dialyze patients, people from all over the country wanted to get on those 4 machines that they had. How do you have 4 machines and 50 states? And so what they did, which, was a rationing system, they had no choice, was to say, we're only going to take people from the state of Washington. One of the reasons was they had to figure out how they were going to only be able to dialyze people with 4 machines. And the state of Washington had given some money for it. But it was really tragic that in this country, you had to live in the state of Washington and you had to be chosen to have your life saved. And it was picked up in the news, and there was a huge article in Life magazine at that time that said, who decides who can live or die? And that this was such an unethical way of doing it. I mean, that's just one example. But what ended up happening is eventually the dialysis transplant situation was passed by Richard Nixon in a bill that he wasn't even aware of, that they snuck in. And that's how we got it on a national level. And what you say about Obama, it's not that I'm disagreeing. Politicians are always going to be politicians. And we know we can't trust them. And we know that Biden, the insurance industry, was one of the biggest supporters and put the most amount of money into the Biden campaign. And so he's not going to get rid of the insurance industry that we so desperately want to get rid of, because healthcare should not be based on profit making by these insurance companies. This is taxpayer money going to Wall Street and private insurance companies. And we're not talking about small amounts. In the new bill in Washington that's trying to privatize Medicare, 40% of the money from taxpayers is going to go to private insurance companies and Wall Street investment banking firms. This is criminal.
Absolutely. So that was a great conversation, and the clarification and all of that. Love to see it. Can we bring in Elizabeth and get you to introduce yourself and tell us a little bit about you and your involvement in the healthcare system, et cetera, et cetera?
Yes, absolutely. So my name is Elizabeth Meyer, and I have been a registered dental assistant for the last decade. I've worked in nonprofit, corporate dental, and private practice, both in front office and back office. I'm very grateful that most of my experience is working in low-income communities, helping those in their most crucial time of need, regardless of their ethnicity, legal status, or household income. As the dental van coordinator with the nonprofit, I maintained and operated a 31-foot RV that was renovated into a 2-chair mobile dental clinic, being utilized for countless community events, such as Dentistry from the Heart, Project Homeless, Homeless Veterans Stand Down, Children and Adult Dental Health Days, along with many others. As a volunteer in my community, I have also been the triage team lead and an overall dental team lead for Compassion Vancouver Heights in years past. And all of these clinics consist of providing completely free, at the point of service, cleanings, fillings, extractions.
Looks like we have lost Elizabeth.
But
okay.
Also, before she comes back, I just want to say she is one of the reasons this is happening this weekend. She works 24/7. She is hardcore for this organization, and we could not do this without her. Yeah, I'm talking about you, and I hope you heard me too.
I don't know why StreamYard keeps giving me the boot, but I'm so sorry.
Quite all right.
So I am now currently a national organizer with the March Medicare for All, and I really do want to thank my teammates on the National Steering Committee, Savage Joy, and the tech team behind the scenes for encouraging me to participate this evening, because I am incredibly nervous to be here, but I am very thankful that you have me here tonight.
It's cute that you said encourage when we really forced you to.
Yeah, I wanted to put it lightly.
I totally forgot to say why I'm on this panel. I before I became blind, I worked in healthcare for over 10 years. Medicare, pre-authorization, CHIP, medical assistance, grievances and appeals, pretty much everything on the administrative call center insurance thing side.
Okay, so that gives us kind of a state of the case for each of you. So if you could maybe each give us a little bit of an idea of how, the past couple years have increased your, your basically your vociferousness and your like larger understanding of how much we need to get to a Medicare for all single payer system. What particularly over the pandemic has stuck out to you, or any stories you want to tell us, or anything like that that just would kind of give us a little bit of more of an understanding of the urgency as you see it.
I'm going to start out with a story because Elizabeth very much wants me to do this story. And then I'm sure I could probably talk for 6 more hours about other stories and other things that I feel about the pandemic. But I think that this story will give you a good idea of where I'm coming from and why I changed course in terms of my medical career. You'll understand it better. So basically in medicine, it's customary to open a discussion by presenting a case at the hospital, and I would like to tell you about my patient, Mr. Rodriguez, a 36-year-old gentleman whom I was treating for high blood pressure in the nephrology clinic at Columbia University Medical Center. His PSA was rising, that's his prostate antigen, and it was rising rapidly. So I referred him to the urology clinic. And the first available appointment was in 9 months, and it took several years to complete his workup. But if he had been able to see a private urologist in the office, his workup would have been completed in less than 4 weeks. But no private urologist at the hospital, at the huge, impressive medical center, would see Mr. Rodriguez because his health insurance was Medicaid, insurance for the poor, which pays doctors poorly. And that's no pun intended. Since Mr. Rodriguez's active medical problem was now prostate cancer, because I had controlled his blood pressure very effectively, I had not seen him in the hypertension clinic for several years. And while I was attending on the inpatient renal consult service at Columbia, I was called to see a new patient with acute kidney failure due to kidney obstruction. I walked into the room, and there was my Mr. Rodriguez, pale, tremulous, and gravely ill. As he and I reconnected, I will never forget the expression on his face. It was so painful to see him try so hard to smile, which he did, acknowledging my presence, recalling the warm, trusting relationship that we had had for several years. And I thought that maybe I had reappeared and that this time I would be more successful in providing him with what he really needed. But what I really saw in his smile was the fear, the pain, and the anguish of impending death. 9 days later, at the age of 39, Mr. Rodriguez died from complications due to prostate cancer. He died because he was poor. He died because his health insurance prevented him from being treated in a timely manner. And he died because the American healthcare system treats patients differently depending on their insurance, their race, their ethnicity, and their socioeconomic status. This is injustice at the most basic level, the most primitive level, at the level of just plain and simple survival. Access to healthcare is a moral issue. It should never be an economic one. And this is why I support universal single-payer health care, so that we can give everyone in the world, not just in this country, the chance to live a decent life. Various life experiences often precede one's commitment to fight for healthcare justice. And I came to work with PNHP for healthcare justice for several reasons. One, because of patients like Mr. Rodriguez. There are many of them. Others have had personal tragedies, nightmarish experiences where in illness, life-threatening or not, resulted in bankruptcy or death. But I personally also came to support healthcare justice for another salient reason. Over the past 30 years that I've been practicing medicine, I have witnessed the rise of the medical industrial complex. I have become disillusioned. I went into medicine because it was an art as well as a science. In the early 1500s, Philippus Paracelsus, a physician and philosopher of the German Renaissance, said that medicine is an art because the character of the physician may act more powerfully upon the patient than the drugs that are employed. Mm-hmm. I have witnessed the erosion of this sacred doctor-patient relationship by the medical industrial complex. I was tired of being told repeatedly, Dr. Kunis, you're a great physician, but you have to bring in more money for us. If my purpose was to make money, I would have gotten an MBA, not an MD. In fact, I did take one course at the Wharton School as an undergraduate, the business school. It was one of the most highly regarded courses at the University of Pennsylvania. The professor was world-renowned, a great lecturer. Everyone loved the course, not me. With all due respect to classics majors, it was Greek to me. And interestingly, medical schools used to choose their department chairman because they were great scientists, great clinicians, great physicians. But now they have to be great business people. If medicine is an art, the medical industrial complex has shattered it. I believe the for-profit business model has no place in medicine. It belongs on Wall Street, and I don't even want it there. I recall a poll where people were asked, what is the quality that you believe is most important in identifying you as an American? The answer was fairness and equal opportunity. But this, my friend, does not exist in the American healthcare system. So I ask every one of you who is here with us today to think about all those people, over 1 million just in this country, 1 in every 300 people who died from COVID-19 or just didn't get treatment for any other illness because going to a doctor or a hospital was just too damn expensive. So despite all the injustices that exist in this world today, that many of us experience daily, I believe that healthcare injustice is the greatest injustice of all, and one that could easily be remedied in the wealthiest country in the world. Thank you.
That was excellent. Really powerful. It really summed it all up, and well spoken. Wow.
And there are other things that Elizabeth and Anna Malinow wanted me to discuss, but let's hear from Elizabeth because I don't want to take up all the time when we have so many great people who have so much to offer.
No worries. I mean, I don't have a specific story for a patient because I've seen with all of these different dental clinics that I've done throughout the years, so many people in need. And I've personally been supportive of single payer since 2003 when Representative John Conyers started introducing the legislation into Congress. And that was right about the time that I was actually graduating high school. So I was entering, the workforce as an adult. And, I really just didn't realize until after I went off of my parents' insurance how things were.
Okay, more technical difficulties. Do you want to hop in quickly, Joy, while we wait for her to return?
Yeah, so there's a bunch of stories that stick out, unfortunately. But in Pennsylvania,
Here we have.
Continue.
Yeah, I'm sorry. I don't know why StreamYard is kicking me out every time I start talking. I apologize.
No need to apologize.
So I just started, personally experiencing the issues with our healthcare system. And then being a volunteer in the community opened my eyes to the actual, inequities that everyone experiences. It's absolutely ridiculous, the system that we have. And, Bernie ran in 2015, 2016, and that really sparked the fire within me. And I was already in the dental field at that time. So, it's not just these past 2 years. It's made that glaringly obvious to a lot of people that we need a better system in place. But I've been angry about this system for quite some time because I've seen the people that are hurt by it and the people who are left behind by it and left out by it. Yeah. And, cost is the number one reason why Americans don't get regular dental.
You went again. It's okay. Live things. These things are going to happen. It's quite all right. So, Joy, you want to continue until she comes back?
The second I start talking, she's gonna come back.
I'm sure.
There you
go. Magic.
I don't know if I should keep speaking or not because it's going to keep kicking me out.
As many times as you get kicked out is as many times as we will welcome you back, and we are happy to wait for you. So
we, cost is the number one reason why Americans don't get regular dental care, and 1 in 3 Americans lack dental coverage. But let's be honest with ourselves. Dental care is an afterthought in this country, and I personally know too many people who delay treatment due to cost. And I know that everyone on this panel and everyone who's listening knows somebody who has delayed dental treatment because of the cost. Having a root canal done to save a tooth, getting a crown put on a broken tooth so you can chew on that side, getting a denture. We've done at clinics full mouth extractions for patients who are recovering that were previously addicted to methamphetamines and have something called meth mouth. We would extract all of their teeth, do impressions, and give them immediate dentures. And it changes their entire life. People who wouldn't open their mouth to talk to you, cover their mouth when they smile or they laugh, it changes who they are entirely. And I know people who have relatives who have passed away because of dental infections that continue to reabscess.
Oh yeah.
And to think I'm in New Zealand and I have no problem with
I know, right? There's no accounting for the tech in these situations.
You're back, Elizabeth.
Yeah.
Oh my goodness.
Just keep going. Yeah.
It's a major issue in this country. And like I said, it's an afterthought for dental. I used to support the state-by-state efforts here in Washington State specifically, but I had, like a come to God moment where I realized that all of my family that live in Oregon or across the country, they're not going to be able to have the same access. And that is just morally wrong. You know, I'm not okay with that. I believe in healthcare without borders. And when I say healthcare, I mean improved, comprehensive coverage for medical, dental, vision, mental health, alternative medicines, going to see a chiropractor, getting acupuncture, in alternative actual medicine, like earlier today, Purpose First Duo was talking about. And I believe one of the earlier panelists as well, talking about psychedelic medicine. You know, we need to be able to access all of these things, and we don't, because of the death care industrial complex. It is kind to say the medical industrial complex, but this is a death care system that we live in.
Wow, that's powerful.
I mean, yeah, that was technically a mic drop moment.
Yeah, really
you
was.
know, one of the things that really ticks me off is that dentists have zero interest in universal health care that includes dental, because they're getting away with murder. I mean, you know, most people know that, you know, even if you have dental insurance, I've been so fortunate that, you know, my husband has always been employed by a major hospital. I was also for many years, and I left, and it's another story Anna wants me to tell everybody. But so I've always had great health insurance. And I've had dental insurance, but, you know, it covers part of it. And fortunately, I haven't had serious problems, and whatever isn't covered, I could afford to do. But most people can't. And dentists, they like it the way it is, because they're as bad as some of the hospitals and insurance companies, et cetera. They can charge whatever they want. So, you know, we're trying in New York. One of the people on our board at Physicians for National Health has been trying to get dentists to work with us, and they won't do it. They don't have the will, because they're there raking in money from patients who don't have health insurance, who don't have dental insurance, and who do have dental insurance. And so, you know, they're a group that we really have difficulty with, and that I hate to say it, I just don't have a lot of respect for the profession for that reason. And I don't mean you, Elizabeth. I don't mean you. You know what I'm saying.
Yeah, I want to definitely make sure we get Elizabeth to finish what she was saying, and you know, and maybe respond to that. And I just wanted to add, I heard someone say that, you know, the medical industry has gotten us all, especially in America, to think of teeth as like these special fancy mouth bones and not part of the rest of our bodies for some reason. Like, it's why are they two separate things? It doesn't make any sense. And please, Elizabeth, continue.
No, I'll just speak to that, because that's absolutely true. Working at the free clinic, the nonprofit, previously, you know, we had not only a dental clinic, but also a medical clinic, and we would run simultaneous clinics. So if patients came in with a dental infection, but they got in line for the medical clinic, the doctor would do an evaluation, and honestly, they would freak out, because apparently the oral cavity, your mouth, is completely separate from the rest of your body. They do not consider that part of your body, and then they throw you off to somebody else. And we have patients that go consistently to the emergency room and to urgent care, and all they get are pills. They either get a prescription for an antibiotic to treat the infection, and then they get pain medication. They do not receive treatment in an urgent care or an emergency department. So then they
Okay, well, there we go again. I'm sure she'll be back momentarily. So, the death care thing, and B, this whole thing about dentistry it's really, I mean, to hear that they specifically don't take care of teeth at urgent and emergency care, it's wild.
That just happened to me last week. I went in for a toothache to the emergency room, and they gave me an antibiotic. But it was a toothache. Like, I mean, I thought I was dying. Like, the worst migraine, my entire face hurt. I couldn't sleep. Excruciating. And they gave me an antibiotic. Thankfully, it worked. But it cost me $100 copay to even go here. So,
Wow.
But I digress. Continue, Elizabeth.
Oh, no, you're fine. That's exactly what happens. And, you know, it blows my mind that these professionals who go to school for so long just disregard your mouth. You know, when you come in to see them, you're looking for help. And one of the things that I've come across being in the dental field, as I mentioned, I've not only worked in nonprofit, but also corporate, where they just treat you as a number. You're just a cash cow for them. And it doesn't matter if you're a patient or if you're an employee, you are replaceable. And then in private practice, as an employee, you have to upsell. You have to talk people into getting things that they don't actually need at the time. No one really tells you that when you have a root canal, you don't have to get a crown on that tooth.
That is true. Second opinions, even though they're not cheap, in dental, my husband just went through that. They told him root canal. He went back and the woman said, I don't know who told you this. That's not necessary. They do upsell all the time.
Constantly. We upsell. We are forced to upsell because the private practice is functioning just off of the private insurance. They will accept some cash pay patients, but it's not very likely. You have to have some proof of assets and things like that you are going to, you know, solve this bill within 90 days. The other portion of it is dealing with the insurance companies. I mean, I actually have now allowed my registration to lapse because I am just so fed up with this broken system, and telling patients, you know, we submitted your pre-authorization. Somebody who's never done an evaluation on you before is telling us that you don't get to have this treatment, that your insurance is not going to cover you because they've never even.
Let's give it a couple of seconds.
Well, I am on video, yes. Then use that bathroom. Oh, you can go in the bathroom. You're wearing clothes.
Keep going, Elizabeth.
Man, StreamYard keeps trying to hold me down. Is StreamYard ran by the NSA or something? What's going on right now?
No, it's literally run by dentists.
Yeah. Big dental.
Oh gosh, big dental.
Being held down by big tooth. Okay.
Yeah, so I mean, I see it all the time. There's waste, there's overages, there's fraud even. People are getting treatment that they don't even need, just so people can bill out to these insurance companies and make money. It is disgusting. And you know that is happening across this.
Yeah, they're really on it, huh?
She should change her location where she is, maybe.
Maybe so.
Could be it.
If you guys don't mind, I'd like to actually give Elizabeth a quick suggestion. You notice that when she speaks that there's quite a bit of distortion, and I would probably guess that you're not using like a explosive cover, like a you know, like a foam cover, something that gets rid of explosions. If you want to try, maybe back away from your microphone a little bit, we'll see if that takes care of the problem.
Well, I'm using my headset. Should I not use that anymore?
And it's kind of fixed, so you gotta maybe just not be right in front of your face. Maybe lower it below your chin. We'll still be able to hear you, but then it won't pick up the. And there she goes.
And she's gone.
So much for that idea.
It was worth a shot. It was worth a shot.
All right, I'm out of here. Bye.
Bye. So, what do you think? Do you think we want to, Joy? Do you want to start going, and then maybe we'll let Elizabeth's stream settle in for a while, and we'll get her back in, and then we'll get, you know, kind of more of a little bit of a flow after we've gotten you all to tell a little bit of your stories.
Sure. I mean, I have so many, but there's one that I just will never shake. You know, in over 10 years in the healthcare system on the administrative side, you see so many things as well that a lot of people don't think about. You know, when I was working in Medicare, I used to have like 90-year-old people send me their water bills and say, look, I know I have a $20 bill due, but I have this $40 light bill or electric bill, and I can't do both. And you're looking at these documents and you're like, this is violence. That's it. It's violence. Like, you really want elderly people to sit there in the dark so they can pay this? It is so inhumane. In Pennsylvania, we had something called adult basic. And people used to call it adult CHIP or whatever. I worked for CHIP. It's not.
What is CHIP?
But in any case, this was before Obamacare, which the one good thing about Obamacare, it did take away the pre-existing condition clause, which changed a lot of our lives. So I will never take that away because it really changed many of our lives. Not far enough, but it did. So this was before then. So people were absolutely denied when they would apply for healthcare. Some people because they're a woman. Some people, they literally would ask if you had allergies and would deny people on that, depending on the company. So we had this Pennsylvania state program called Adult Basic, and it was basic. Here's the flaws with it. $638 a month. And this was a few years back, so it was even, it was expensive. Also, it covers only medically necessary, so that's pretty much nothing by the time they get through approving, denying. And it puts you on a waiting list to get it for like $239 a month. But during that time, if you cannot afford the $638 to get on that insurance, you are not allowed to get any other insurance. If you get some other insurance, you are kicked off that waiting list. The waiting list was over 3 years long. Then what happened? Our governor did away with it. All these people have been on a waiting list for 3 freaking years, lost any hope they had. Sorry, you can't get health care because you're on the waiting list. And then they went all that time without it. And I worked at the call center. I had to take these calls when people see on the news, oh my God, this is, I've been on this waiting list. It's the only hope I had of healthcare because it's the only way to get it with a pre-existing condition. I used to talk to women with breast cancer who literally had to stop chemo treatments and stuff like that, and were on adult basic because it was the only way they could possibly get care, and then they were kicked off the waiting list anyway. So, but the one story in particular, which just, I hope I don't get emotional, but there was this woman who called, and like I said, it was the only option in Pennsylvania before, the pre-existing condition clause ended. This woman called, I picked up, and I heard moaning in the background, and then kind of some garbled screams. And the woman was hysterical. She said, I need insurance. I need it. My son needs it right now. And I said, ma'am, just go to the hospital. What's wrong? And she said, my son was just shot in the stomach. And we can't go to the hospital because we cannot afford the bills we're going to get. Can you give me insurance right now over the phone? And I couldn't. There was literally no way. Regardless where you get insurance, there's a time. It's the first of the month, or you need payment first. And I was just at a loss. I'm sitting at my desk just bawling. I'm I don't know what to do. And finally I convinced her to just take her son. And I said, ma'am, and I went against the rules because I really don't give a shit. And I gave her my personal email so I could try to help find services and stuff afterwards. Thankfully, Medicaid, picked up retroactively. But the point is, this woman literally has her son dying, bleeding behind her on the couch, and she is begging for health insurance instead of taking him to the hospital. That is the violent capitalist system we live in right now.
Wow. It is really, really difficult not to, that underlines for me, like you said, Joy, the inherent violence of this system. And this is the basal layer of it. This is where once you are not useful for whatever reason, right, you can go and they don't care. And the fact that the first thing this person had to think in order to save her son's life was how they're going to pay for it. When people talk about civilized nations, and there's been a lot of discussion about civilized nations, the absolute barbarity of not being able to save someone's life. Look, you could go 10,000 years ago. You could go any number of thousands of years ago in any human society. And the number one thing is, if somebody's hurt, you fix them. You might not know how, you might not have stitches, you might have to throw some mud on it and call it a day, but you do that. And here, we don't even do that. And that is the reason why we need to be so much more vocal about these things, because this is the bottom layer of everything. This is everything. And wow, that story just really upsets me, because I've heard similar things like it. And I've had some friends be in situations that were like that as well. For those reasons and for other reasons, if you can't get help, with your health, you can't have anything. So I want to bring in, just to kind of shift gears, let's talk about some ways that you think that we can help people to A, realize how important this is, and B, ways that you think that we can get towards this goal.
Well, obviously, education is so important, because we really need to let people know what's going on. One of the things that really bugs me is that until people have the personal experience, they don't realize it. They think, like everybody talks about, the United States has the greatest healthcare in the world, the greatest doctors in the world. We have all these wonderful medical centers. Yeah, we devise and we develop all these great drugs, but they're not affordable. And that, when you have Medicare, one of my patients who has lung cancer now, she's got traditional Medicare, and she's got a secondary that's one of the California secondaries. She's still paying a significant amount of money as a co-insurance for her chemotherapy. And that's one of the reasons we talk about improved Medicare for all, because despite the fact that because traditional Medicare pays 80% of the Part B health doctor visits, there's another 20% that has to be paid for. And that's the unfortunate reason that so many people go into Medicare Advantage, which absolutely is a for-profit system. Medicare Advantage, the insurance company takes the Medicare money from the government, from the taxpayers. They divvy it out where they take a 15% profit on the top. They take that 15% profit. It used to be more, but the ACA told them they couldn't take more than 15% profit. That is still hundreds of millions of billions of dollars a year of taxpayer money that they're getting. The other thing that Medicare Advantage does is they get even more money from the government because they do something called upcoding. And I think that some of this was discussed in the former, the former session, so I'm not going to go over it. But it's amazing how much more money they get, and that's all profit for insurance companies and Wall Street investment firms. If taxpayers knew that their money was going for corporate profit, maybe they'd start thinking about it a little bit more. They wouldn't have to just have a medical condition where their family went bankrupt or died because they didn't have health care. So the first thing is that we at our organization speak at churches and senior citizen centers, as I mentioned. We have rallies and protests in New York, in Albany. There are a number of protests where, we'll travel to various places. We go down to Washington. So we're really trying to make it vocal. We need op-eds. We need things in local newspapers as well as big newspapers, like the New York Times, that are telling people what's really going on, so that maybe eventually it'll get into their heads what's going on before they end up in trouble. All of those those are the ways that we can get the American people to come and work with us, because we, the people, hopefully will have the power. And our politicians may say one thing, and when they get into the office, it's something else. So how do we deal with it? It is so frustrating to be able to deal with these politicians. And although you said that Obama didn't want to do it, I guess also what I'm saying is that I think that if you took Obama when he was 30 years old and he, was not president of the United States and he wasn't even in politics yet, I believe that he is the kind of human being who in his heart and mind understands the plight of the American people.
He literally campaigned for Bernie Sanders, literally, before he became president. Like, he had populist views. And, if only we had him that way. He kind of changed a little, but like, you can literally go to YouTube and see him endorsing Bernie and, like, praising him. It's truly astounding.
Yeah. I recently saw him at an anti-war rally.
The whole world, though, I mean, when you see what's happening with this movement that put Trump into place, I mean, it happened in Brazil. It almost happened in the Netherlands. There's this really terrible sort of right-wing belief of populism that, history obviously is cyclical, and it's happening, and we have to prevent that as well. So I think that the main thing is to get behind the movement, to get people to understand. We have to start at the local level, where we have people in small areas all over the country, making it clear what the government is doing just in terms of destroying Medicare now and getting private insurance companies to get in there. That private insurance companies only have one thing, and that is to make money for themselves, their CEOs, and their stockholders. They couldn't give a damn about healthcare. And that's the problem now, is they're all getting in on the bandwagon. That's what this whole DCE REACH thing is about, that hopefully we can stop now, which is one of the reasons that many of us are working in that area, because it's an area that is not yet law, that is not yet accepted, but which the government is doing under the radar. We have to prevent this from happening. And it's a very, very tough situation, but it's life or death. That's why I said in bioethics, we feel healthcare is a very unique phenomenon, different from any other form of entitlement that people have being residents of this country.
Yeah. And I mean, maybe you've talked about this before. What is DCE REACH?
Okay, that very briefly, and that's something you're going to be hearing a lot more about. So basically what happens is that the Medicare system, as I mentioned, has costs that are in addition to receiving Medicare, where you paid out of your paycheck for many years. So the Bush administration put into effect Medicare Advantage. And what that is, and I think I mentioned before, that the private insurance company takes Medicare trust fund taxpayer money and they divvy it out as a private insurance company to the Medicare beneficiaries. And there are many ways that they make more money, as I mentioned, by upcoding and by denying care. Let me give you an example. My patient had a head and neck cancer. He went to a doctor who took Medicare Advantage at Mount Sinai because they're one of the hospitals that take it. And not every Medicare doctor takes Medicare Advantage, because another way the private insurance companies work it is they pay the doctors in the hospitals less than traditional Medicare. Patient was there and the doctor evaluated. The doctor decided that that he was planning on surgery in a couple of weeks, that he would be able to cure this man. The man was 65. He had just gone on Medicare, and his company demanded that it be Medicare Advantage to, quote, save money, which is a bunch of baloney. So what happened is the doctor said, well, in order to do the surgery, I need an MRI. I need a total body MRI, because I need to make sure that your cancer is only in your neck, that it hasn't spread anywhere else, because I don't want to put you through this surgical procedure if your cancer has spread to other areas, because the treatment would be different under those circumstances. His Medicare Advantage plan said, we will not allow an MRI. The MRI at Mount Sinai was $12,000. Now, there is no reason in the world an MRI should be $12,000 when in the UK it's $400 or $500. Okay? They said to him, okay, well, if you'd like, you can appeal it. His wife said, appeal it? How long is it going to take to get an appeal done? So they said, oh, well, it could be 3 months. And then she spoke to various other people who had had the plan, and they said, oh, it took a year to do the appeal, and then it was accepted. It turns out they tell you to go for an appeal, but it's going to take so long, most people don't do it or they drop it. Okay? Well, you know what? The woman said, I don't understand this. My husband's, I don't want him to die. He's got cancer. And fortunately, she said, we'll just have to use some of our savings. And she paid $12,000 for the MRI. The patient, I can tell you, it's 2-3 years later. He's, thank God, knock on wood, he's fine. But this is what we're dealing with. It turns out that 85% of their denials, if you stick with it, are things that shouldn't be denied, and they accept it. But that's the whole thing. It is true that fee-for-service healthcare has a lot of, probably many unnecessary procedures that are being done. But if you look at the total amount of money spent for traditional Medicare, it's still less than Medicare Advantage, because you don't have the middleman there. You don't have the insurance company there making a killing on it. The insurance companies in Germany are non-profit. They do have insurance companies, but from 1880, when they were started by a terrible human being, Bismarck, which Dr. Brown mentioned yesterday, the reason that Bismarck gave his people health insurance is because they were emigrating to the United States, where miners and carpenters made more money in 1880 than in Germany. And Bismarck wanted to keep them there because he wanted a great economy for this country. He wanted Germany to expand and take in all the little duchies, and he wanted to improve the economy. So he gave them health care, and they stayed in Germany. He gave them disability insurance. He gave them funeral expenses. He did all of that. He did it for the wrong reason. He didn't do it because he cared about the people. He was a terrible politician, as a human being, he was a cruel, nasty human being. But he gave them health care and they stayed there. And that system of nonprofit health insurance to this day has given Germany one of the best healthcare systems in the world.
And I noticed that working in admin too. Like when I worked in appeals and grievances in Medicare for over 3 years. And let me tell you, people were not appealing bills for $10. Every single appeal was like thousands. And it's like, okay, that's what they're being denied for. The really big dollar things that people need. And I was just like, approved. Like, I'm not doing that to people. But, you know, and now after what happened to me 2 years ago, you know, for anyone watching who doesn't know, I woke up 2 years ago without 85% of my eyesight. And I've been legally blind, missing 85% of my eyesight for 2 years now, unexpectedly. And when it first happened, I went to the hospital and they said, well, your disorder's rare. You're never going to get any of your sight back, but we can give you eye injections, which will at least help save what little sight you have left. So at this point, I'm traumatized and I'll like try anything. And they said, well, it's $12,000 per eye every 30 days. We just called your insurance. They have denied it. You're too young and it's too rare. So you have two choices. You either sign this document that says you will pay the $24,000 personally, or we have to appeal it and we're not sure how long that will take. Now, at this point, I'm still working because this happened out of nowhere. So I'm like, okay, I'm working a contract job. I have no sick time, nothing like that. And I just had to call out of work continuously until that was approved. And then when it was approved, it still had caveats and everything like that. So everything like that exacerbates any kind of disability or trauma or anything like that. And I also interviewed a gentleman, Rusty, a few times. He had testicular cancer and he was turned down by an insurance and it spread all throughout his body while he was trying to appeal it. And 6 months later, just cancer all throughout his body. And then after over 6 months of appeals, then he got health care. But it still wasn't free, of course. But, just like Cheryl said, these things could be more preventative, but it's not profitable to be preventative.
Right. Seems like the conversation has even been stolen from, thriving is what we should be aiming for, not just merely surviving and just barely being able to stay alive, but like everyone being healthy and being able to live as robustly as they are able. And that the fact that we're not even, we're fighting for just staying alive at this point. And we're going back to what you said, Cheryl, like the person being able to pay that $12,000, like, the average American, and this was before the pandemic, more than the average American, like 75% of people could not afford a $400, $500 emergency. So, and since COVID has happened, I'm sure that number is way more because everyone, not everyone, but, lots of people lost what little they had saved up. So it's even more dire now. So this is it's a really horrible situation. And I think also just wanted to go back to something else you said, Cheryl, which is information and getting people to really realize how bad things are, right? Because I've learned already so much just about like, how it works and what they're denying, what they're allowing. And it's like, I knew it was bad. And obviously for me, it's a top line item, but it's like, no matter how bad you think it is, it's worse. And that is something we really need to impress upon people. I wanted to see if we can get Elizabeth in here as we are like approaching a close. Just want to see if you'd like to contribute.
Does my mic sound okay?
It does,
now?
yes.
Okay. So electoralism is not the route. I am do it from the outside the system, burn it to the ground kind of radical. And I want us to all imagine what we would like this to look like for ourselves, not for the corporations, not for the government, not for Wall Street, but for us, the people who take care of our elders, who, take care of our kids, who work and run. We are the ones who make this country happen. And we need to reimagine how this country should be. And fight for all of us. So I just kind of wanted to maybe say thank you, because I don't know how much longer StreamYard's going to let me stay on here. So on behalf of all the volunteers and organizers at March Medicare for All, I want to thank each and every one of our hosts and panelists for taking time out of your busy schedules to participate.
I second that.
Yeah.
And also, that made me think of something else. When I think it's a huge misconception that Americans think that, well, if you go to a hospital, they have to see you. Maybe in theory, it's supposed to be that way. But I've interviewed Amy Bilella, who will tell you legit, her daughter went to the ER with a blood clot in her leg, was not seen, and died. She was 21, I believe. Wow. And maybe they were supposed to see her, so they didn't. They said, you don't have insurance. We are not seeing you. So just because it's not supposed to happen does not mean it doesn't. This is why we need national improved Medicare for all. So shit like that doesn't happen.
The voluntary hospitals and, of course, the public hospitals will see emergencies. Okay, so that if you're having a heart attack and you go to a private hospital, they're supposed to take care of you, but transfer you. So, for example, one of my patients her husband has Kaiser Medicare in California. Actually, this is the partner of the person who I mentioned before, who's paying $1,000 each month for her chemotherapy with traditional Medicare. But when he had a heart attack, he was taken to the nearest hospital, but they said, we're not going to do any intervention or whatever. We're going to just make sure that you're okay. And we send you to a Kaiser hospital because your insurance is Kaiser. But you never know. I mean, I know people who have died because they've had to go to a Kaiser hospital and it was too far away. Right. So there are just so many problems. And I just want to put in a plug for how the ACA is just such a bad system, and all this garbage about improving the ACA. The only way you can improve the ACA is to get rid of it and make it a single payer system, because I can tell you that private health insurance, in fact, I was surprised that there were some people in my organization who were, big healthcare, progressive, radical people, and they didn't realize that when you have ACA Blue Cross Blue Shield, that's not Morgan Stanley Blue Cross Blue Shield. It is much more limited, and you know what? It's damn expensive. And I can just tell you that I'm just going to quick story, and this is very quick. I'll try. My son's wife, 34 years old, was hit by a racing biker going 70 miles an hour in the park. She was wearing a helmet, walking with her bike. They smashed faces with each other. There was blood everywhere. My son was called right away, ran over there. My son said, Mom, it looked like a murder scene. The ambulance took her to the closest hospital. They had Oscar, which is the worst, Obamacare insurance. It was costing them $16,000 a year with a $15,000 deductible. These are not high-income people. My son is a student. He's actually going to be a health policy expert, believe it or not. His wife is an avant-garde British theater producer. They're pretty low income, but they're not low income. My son doesn't believe in going on Medicaid, even if he could, just because he thinks it's unethical, that there are people who need it more than he does, because, you know, his mother will help him if need be. Anyway, they don't want to pay for the hospitalization, and their insurance says if it's an emergency, it doesn't have to be an Oscar hospital. This was a Columbia University Medical Center, quote, affiliate, and they didn't take Oscar health insurance that is owned by the Kushner family of the Trump group, okay? It turned out that they were pressured, and out of the $30,000 bill, they paid $3,000. Her mother sent money from London. I paid all the dental work. And then what happened is they kept saying, well, you should go to a dentist that's in, she had to have root canal and everything because her teeth were destroyed from the accident. And her whole mouth had to be sewn up and her lips and everything. And they're giving every excuse in the world. And he said to me, Mom, I'm going to sue Oscar because, not because I know you paid for the health care, but I want to sue Oscar for the principle of the matter, that this is an accident and they went against their rule. I spoke to him last week and he said to me, you know what, Mom, Lucy and I talked about it, and I do not have the energy to deal with them in any way, shape, or form. I have been on the phone with them getting the biggest bullshit forever for 8 months. And Mom, I just can't deal with it anymore. I have to go on with my life. And I know I am fortunate that I had parents who could pay for it. But he goes, most people don't. And that's what makes me feel terrible. He said, most people in this country couldn't do what I was able to do for my wife. And I feel so guilty about it. We got her to the best plastic surgeon at Mount Sinai. That still cost a lot of money, but at least they knew they were getting the best health care because the mother could pay for it. And anyway, he's given up on that health insurance. And I think that is a serious issue. And that's only one Oscar story. I could tell you many, many more. Most people give up. But, you know, it's funny, Joy, you mentioned about how they're only doing the MRIs and the CAT scans because they're expensive. That is true. But I can tell you that one silly consult that I did, that they would pay me $170 for, it's United Healthcare. They want all the records. They want this, they want that. You know what? It's not worth my time. So they can get away with it because I can't be bothered. So they're even going for the little ones, not just the big ones. And United Healthcare during the pandemic has never, ever made more money because they didn't have to pay for elective surgery. Their stock went up 10 times. People made absolute fortunes on United Healthcare stock because during the pandemic, they were like bankruptcy lawyers. They've never done better. They made their money off the pandemic. Is that a disgrace to this country? I find it so disgraceful.
Yeah, and that's why I said on a prior panel today, you know, people say, well, we get free vaccines. Well, okay, but they're not free. You know, they're free to you, but the fact of the matter is, look at Pfizer, how much they've made in the past year and a half. Billions and billions. They're not doing any favors. They're not, oh, we want to give you vaccines because we care about you. Like, they're getting even more rich. That's awful.
I do know people who wouldn't take the vaccines because they didn't trust the pharmaceutical companies. That I have a little trouble with. I tried to explain that the vaccine has been proven to truly, you know, and the booster specifically medically has been shown to, you know, improve the prognosis with Omicron. But that's how rabid people were feeling about the pharmaceutical industry. But you know what? I have to be honest with you. The hospitals are doing everything they can. The prices of the emergency room services are insane. There's no such thing as a cost of anything. Like, I always say, you go to Macy's, the dress is $140. It might be full price at Bloomingdale's, but if you go to Macy's, there's always a coupon, there's always a sale. There's no such thing as a price of anything in medicine. It's whatever they can get away with. That's why an MRI is $12,000, because it'll be $8,000 at Cornell, it'll be $12,000 at Mount Sinai, it'll be $14,000 at NYU. It's whatever they can get away with. And the insurance companies know they need the hospitals. They have contracts with them, and that's why they're paid. And that's why the hospitals aren't going to go into a situation where they're going to be getting less money, because they are making a killing as well from the private insurance industry. It is a vicious cycle, and we have to stop it.
Logan, I think you're muted.
Yeah. Sorry about that. I think we're approaching the close, so I wanted to just give you each a chance to, give some closing thoughts and that sort of thing. And I just wanted to say, I just heard from a person who has done medical billing that whenever you deal with a hospital, make sure to ask them for an itemized bill of everything, and that will almost always reduce the amount you have to pay. Make sure you ask them for like a printed receipt, because the more light they have on these things, the less likely they are to charge you as much as they can, because they just want it to get by under cover of darkness because they can get away with it. But just force them at every time that you can, because they try and get by on despair. They really do.
But
thank you all for educating me so much.
The hospitals all use billing companies that have nothing to do with the hospital. The billing company will be in Boston and the hospital will be in Atlanta. They're using companies who couldn't care less. Yes, sometimes people can argue and try to get the cost down, but basically the billing companies, the more they make, the bigger their percentage profit. 10%, 12%. So the more they collect, the more they make. So they've got a vested interest in making more money as well. So, it's really tough. But if you look at a hospital bill, it's unbelievable. They often do send it. I went to the emergency room for food poisoning. I couldn't even get to Mount Sinai where my insurance was, because it was 5:00 in the morning. I went out onto 7th Avenue. The taxi driver thought that I was a drug addict withdrawing because I was vomiting and moaning, etc. I went to NYU in my running gear with my insurance cards and enough money for the cab. Then they wanted all sorts of other ID. And I went, I didn't bring it. I figured this was enough. Okay. I get a bill for $38,000. I was there for food poisoning. I had blood work, and I got an IV fluid, and I got some, they wanted to knock me out because they said I was bothering the other patients and I was making too much noise. And they gave me IV Xanax or Valium or whatever. I got the bill. The IV fluid was $9,000. The IV Xanax was $4,500. I had a $38,000 bill. Now, if I didn't have, I have NYU and I have United Healthcare, Mount Sinai, United Healthcare, NYU. I paid $150, and all I could say was, oh my God, can you imagine if this was somebody with no health insurance, or if they didn't take their health insurance because they had Oscar or they had Obamacare insurance, because NYU only takes one Obamacare plan. If you had the other Obamacare plan, you'd be responsible for $38,000. They're made up numbers. They're made up. They're just what they can get away with, and that's the problem.
Yeah. Elizabeth, would you like to give us some closing thoughts?
Yeah, sorry to everyone who's watching and listening that I keep getting booted. I apologize for that. But I really just wanted to thank everyone, because without the teamwork, collaboration, and the passion that we all share for achieving.
Hopefully.
And Elizabeth told me that she never realized how much work it would be to put this together. So real kudos to her that she'd never done this before, and she did it. And so I think everybody is so grateful to her. And will not stop thanking her, which we all are doing now.
Yeah.
And Joy, how about you?
I've been on like so many panels yesterday, today, and tomorrow that I just there's so much I could say, but I've already had opportunities to touch on so many things. I think the thing I want to tell people is also going with Cheryl, what you said, and Logan. I really want people, when you get those EOBs, don't just throw them out. Look at them. Look at those prices, because those are the prices that you would be paying if you didn't have insurance. So if you get an EOB that says $3,000, even if you only pay $100, look at what that price is. Because if you didn't have insurance, that's what someone is paying.
Yeah, absolutely.
And I think we can all say it's criminal and it is unethical. And if this country is supposed to be, well, we're not going to talk about the politicians, but this is a country of of golden opportunity. If you don't have your health, you don't have anything.
That is very, very real. And I think that brings us to the close, right?
Yeah, Logan, if you want to stay on with me before I transition, we've just been having a hostess
sure.
them both with each other.
Okay, well, thank you, everybody. I think that we're all on the same wavelength. We all feel the same way. We have to get the rest of the American people to feel the way we do.
Yeah,
so thank you all.
Thank you,
and
thank you, Cheryl.
Into some of them, and I know that we can watch them afterwards on YouTube, right?
Yes. Yep.
So that's going to be great. I'm going to, every moment I can, I want to go to the ones that I had to miss because I couldn't do everything, but I'm really looking forward to it because I did do Friday night and I thought it was fantastic. I was like really taken. I really was. So thank you so much.
So much. Like so much. This has been amazing. Thank you so much, Cheryl, for joining us.
Thank you, Cheryl.
Okay, great. Speak to you all soon. Thank you for being here.
Bye-bye.